Welcome to Pharmaceutical Technologies Podcast, What You Should Know About Lean Six Sigma Initiatives. Brought to you by Compliance Insight. Compliance Insight, Inc. is your hands-on quality and regulatory specialists who specialize in regulatory and quality assurance, consulting and training for the pharmaceutical, dietary supplement, medical device, chemical, and food industries. With over 150 years combined experience in FDA-regulated industries, the Compliance Insight dedicated consulting team has the knowledge to support large and small companies in identifying and correcting compliance and regulatory issues. Compliance Insight is large enough to cover the full spectrum and small enough to assure that every client receives personal attention. And now, here's your host for this podcast, Angie Draculich.
Hello and welcome. I'm Angie Draculich, Editorial Director for Pharmaceutical Technology, and I'm speaking today with James C. Weber in Process Improvement Services at Compliance Insight, Inc. on the topic of how to optimize Lean Six Sigma initiatives in a pharma manufacturing company. Thank you for joining me, Jim.
Thanks, Angie. It's good to be with you.
The pharmaceutical manufacturing industry, along with many other global industries, has been working to improve its processes to be more effective in terms of time, resources, and costs for years. In your opinion, is improvement optional or mandatory in today's environment, and why?
That's interesting. Unfortunately, many companies seem to consider process improvement optional. The crisis of the day or the firefighting frequently takes precedence over proactive improvement activities. However, that presents a real dilemma for a company. If somehow, some way, a company can't manage to solve root cause problems, they will always function in a state of crisis management or firefighting. Companies that have figured out how to both address the crises and make proactive process improvements, because you have to solve those crises of the day, but those that have figured out how to do that and do proactive improvements, they have a clear competitive advantage. So to remain competitive, improvement is mandatory. But we need to be really clear about what process improvement really is. At the end of the day, it's not really an improvement if the true root causes have not been addressed through an effective set of improvements that become part of an ongoing control plan. Any activities that don't result in addressing root cause issues will ultimately really be a waste of resources.
Okay, and can you outline the key steps required for effective resource utilization in improving pharma processes?
Sure. One of the most important things a company can do is to find a way to tap the incredible brain power of the workforce that's already there but not being fully utilized outside of their regular jobs day in and day out. Of course, one of the best ways of doing this, as many companies already do, if not all, is through the broad use of improvement teams across the organization. So imagine an organization full of people skilled in the tools and roadmaps for improving processes who continuously go above and beyond their regular jobs by leading or participating in improvement project teams. Not only are people energized by being valued for their process knowledge, they're excited to see real improvements made to the very process problems they've had to live with for years, and they are part of the solution. It does take time to cultivate that kind of culture, including providing training at various levels and in various improvement roadmaps. However, the payback is very hard to beat. Every company has resource constraints. That will always be true. The winning companies are the ones who figure out how to make many process improvements on an ongoing basis in a cost-effective way.
So how can a company best track these improvement projects?
That's a very important thing to address. It starts with having a database capturing all process improvement projects with the right kind of information in it. And it's updated regularly, generally weekly. But the database alone really doesn't do anything. It all depends on what is done with the information that's in the database. If projects are floundering, there must be prompt leadership follow-up to help it get back on track. There's countless examples of projects that died a slow and miserable death from lack of attention and effective intervention. There's a number of ways to effectively track projects. But one of the best ways is for the leadership to have visibility into where the projects are in their roadmaps, for example, at a monthly project review meeting or maybe even part of a regular staff meeting agenda. And these reviews can be structured to be very concise with specific, effective action items.
Now, I understand that many firms use integrated roadmaps to manage their projects. Can you briefly define these and how they are used?
Sure. So let me mention three different process improvement roadmaps or methodologies here. One being Six Sigma, another being Lean, and the third being workouts. There's others, but these three are used widely and definitely in the pharmaceutical industry. Six Sigma is an improvement methodology or roadmap used for improving process capability, or another way of saying it is to reduce defects or improve yield. It's usually reserved for more complicated problems where data will need to be collected and analyzed in order to discover the root causes. There are 5 distinct phases to a Six Sigma project: define, measure, analyze, improve, and control. So it's frequently named by its acronym, DMAIC. Many of the tools used in each of the phases are common quality improvement tools. However, the real power is the roadmap itself. It's a very logical sequence of defining the problem, getting good data on the process and the key variables, discovering the statistically significant variables, developing viable improvements, and locking them in with a control plan to ensure the problem doesn't recur. These projects can range from a complex greenbelt project that may take 2 to 5 months to complete to a much more complicated issue led by a black belt or a master black belt, which could take anywhere from 3 to 8 months or even longer. The different level belts represent the training and experience and skill level of the project leader. Also, let me briefly describe lean and workout projects. There's an entire body of knowledge around lean manufacturing, the lean enterprise, but the principles are pretty straightforward. You want to focus your process or value stream on what the customer wants, no more and no less, with minimal waste of any kind. The roadmaps for lean are really more varied than for Six Sigma from company to company. However, there's a number of common tools and approaches used in lean, including value stream mapping, 5S, visual controls, and using Kaizen events to actually identify and implement improvements. And then thirdly, the third methodology is workouts. It's commonly used in a lot of companies now, increasingly so. When the problem isn't all that complicated and you can make really good progress by getting the right people together to jointly develop an improvement plan after using some basic quality improvement tools, they come up with a consensus, and the actual team meetings could be completed in a day or 2. This approach is commonly used to address what I call the useful many improvement opportunities, to use Pareto chart term. Whereas Six Sigma is frequently used to address the vital few problems. In other words, the big bars on the Pareto chart.
Thanks, Jim, for explaining those roadmaps and the approaches. I was wondering if you could give a few examples of real-life process improvements that companies may see.
Sure. Honestly, I've been involved with literally hundreds of improvement projects, and so, for example, for Six Sigma, there might be a defect problem, a capsule print defect. That chronic rate is too high, or parenteral process yield is low chronically, or a packaging process seal defect, or there's too much weight or volume variation in a bottle filling process. So there are chronic issues that are not easily solved. If they were easily solved, they would have been solved a long time ago. But also, I just want to note that it's not applicable just to manufacturing. It's also used extensively with business processes or transactional processes. And one specific example that I was directly involved in was reducing the cycle time for recruiting. and it was used very effectively. In Lean, there's process throughput can be significantly improved through Lean approaches. A quality audit cycle time could be addressed through Lean. I was involved with a project to reduce the time it took to transfer a production process from one location to another, cut the time in half, saved a tremendous amount of money through that project. Honestly, almost every manufacturing facility would want to be using Lean throughout their operations, and you've probably heard the term lean thinking or lean enterprise. It's pervasive in a manufacturing operation. But again, Lean can be used for business processes. For example, like inquiry to order, reducing the cycle time from getting an order, going to the customers and generating interest in your product and getting the order itself. And then workouts, again, it's a much smaller scale, less complicated issue. For example, having smooth handoffs between shifts regarding communications or documentation or that kind of thing. We've used workout before to improve a number of potential SOX-related issues, and that involved sales and finance and legal. Quality audit findings that cut across multiple departments or sites. Those are things they're not that complicated technically, but you need to get the right people in a room to work on them together.
It sounds as though there are many opportunities there. I was wondering if you could talk a little bit about the advantages as well as the disadvantages when integrating the various improvement roadmaps.
That's a really important thing to address, because a common problem that most companies face when they're implementing these kind of improvement initiatives is which process improvement roadmap to use, because you have really distinct roadmaps, as I've kind of outlined. Unfortunately, some companies struggling with this have solved the problem by forcing all projects into following one roadmap. For example, we'll do everything in Lean or everything in Six Sigma. And that's obviously not a real solution, since different problems may require different roadmaps in order to address the underlying root causes. Also, you don't want to waste a lot of time and resources launching a Six Sigma project when a 1 or 2 day workout project can solve the problem. So the key is to have very clear criteria and expertise up front to determine the correct roadmap to utilize. And sometimes extra time spent in chartering and defining the project at the beginning saves a lot of heartache down the road.
That makes perfect sense. I imagine to move forward, it's key also for a company to have corporate buy-in to a Lean Six Sigma program. So where does strategy and business leadership fit into this paradigm?
That's a really key issue. If you think about it, problems occur in a company from for a lot of different reasons, involving many, many variables. It's complex to undertake an initiative to continually improve processes, especially if you want to be efficient in going about doing that. So the path of least resistance is usually to find workarounds or just put up with the aggravation another day longer. However, for long-term viability, leadership must have a strategy to continually improve. That's a role and responsibility that can't be delegated. Leadership must determine the approach to process improvement. They have to provide the training, the resources, and time to execute the projects and value those contributions with their words and their deeds. Without a solid strategy and committed leadership, no process improvement initiative, including Lean Six Sigma, can be effective. However, with it, a company has a competitive advantage that is very difficult to overcome.
Thank you, Jim, so much for your insight on this issue. Listeners who are interested in more information on this topic of Lean Six Sigma can go to pharmtech.com and click on White Papers to view a full paper by James C. Weber with Compliance Insight, Inc. Thank you.
You've been listening to Pharmaceutical Technologies Podcast, What You Should Know About Lean Six Sigma Initiatives. brought to you by Compliance Insight. Compliance Insight Inc. is your hands-on quality and regulatory specialists who specialize in regulatory and quality assurance, consulting, and training for the pharmaceutical, dietary supplement, medical device, chemical, and food industries. With over 150 years combined experience in FDA-regulated industries, the Compliance Insight dedicated consulting team has the knowledge to support large and small companies in identifying and correcting compliance and regulatory issues. Compliance Insight is large enough to cover the full spectrum and small enough to assure that every client receives personal attention. Thanks for listening.